this will be a good conversation starter in terms of like, what do we want to know after this kind of, midlife point with our health and wellness? So, my name is Abby Horton. I'm an assistant professor at CCN here at UA. I'm a registered nurse. I'm a certified health and life coach. I'm a former Wellbeing ambassador, and I'm one of your wellness class educators. You're welcome to reach me at abby.horton@ua.edu. If you have any questions, comments, feedback, need more resources, just want to connect, feel free to reach out. I'm always happy to get to know you guys, and please do reach out when you see me. A couple of people, whether it's been kind of out in Tuscaloosa or around campus, people will say, "I know you, but you don't know me," and it's because of Wellbema. But that absolutely makes my day. So, thanks for when y'all do that. I love getting to have conversations around health and wellness. And so when we talk about common health concerns for people over the age of 40 or even approaching 40, there are some things that you want to be on the lookout for. Usually it has to do with weight gain and hormones and things like that, but we're going to talk about some others as well, like aches and pains. We have a class on everyday aches and pains, but we will touch on that. We'll also talk about the importance of health screenings. So, for anybody over the age of 40, of course, health screenings should start earlier in your 20s doing your annual exams. You should still continue to do those. But there are some additional ones that you'll want to do once you start to get to the point of like age 35 and 40 and beyond. We'll talk about some useful strategies that will help you in terms of weight loss and health management. And then we'll identify ways for you to stay healthy and fit after the age of 40. But regardless of your age, any of the things that I talk about today will be really, really helpful in terms of making small changes that will impact your overall health and wellness goals. So I'm 39. I turned 39 in February, and I've been teaching this class for a few years. So it's funny that now I'm really approaching 40. I've been saying I'm approaching 40 for a long time, but we're very, very close at this point. For your 40s and beyond, it really is a turning point in your health. And I think it is a turning point in your health, not only because your body starts to change, but also because your life tends to start to change as well. So our metabolism slows down, our cellular growth sometimes will start to slow down, our hormones will shift and change, our recovery and our rest requirements start to really change. And we have to really start to think about prevention and health maintenance. Those become very critical and a key part of our good foundational health. So, what do I mean by all of that? I updated these slides over the weekend, and I thought it would be helpful, excuse me, to have this healthy aging pillar. So there are 5 pillars of healthy aging. And if you guys know me, I love to customize things. And so I actually think that there are more than 5 pillars, but we typically try to keep, pillars or tools really concise, 3 to 5, because that feels manageable. But for those of us who really want to kind of, double down on our health and wellness goals, I really think that there are a few more that we should talk about. So we've got physical activity, we've got a healthy diet, or I would prefer to call that nutrition. And then we've got quality sleep, brain stimulation, and then relationships and purpose. And those are all really important, key components of a healthy foundation for life, no matter what your age. But I also think that with sleep, we have to talk about recovery. I think we have to talk about hormonal and metabolic health. So, metabolic health is going to be your cardiovascular health, your BMI, your blood sugar, your blood pressure, and your cholesterol. So, if you're interested in metabolic health, we have a class on cholesterol and we have a class on heart health. And I talk about metabolic health in both of those classes. Hormones, we have a couple of colleagues here on campus that talk about menopausal health, and I think that that can be really helpful. But we also have, men who have hormonal needs that change after the age of 42, and so I try to incorporate that into this class. We also have the preventative health that I mentioned and the care that I mentioned, and then habits and mindset are really, really important as well. So assessing yourself, I like to do kind of a life audit every year. I tend to do this the week before New Year's when there's kind of that lull and we have our winter break. I'll do a life audit and I'll start to plan out my year in terms of like appointments and vacations and big milestones and all of that. I also like to do an assessment of myself and do some good reflection and figure out, okay, where are some areas that I'm struggling? Where are some things that want to kind of address and improve upon this year? And a lot of it for me revolves around health. So I've had a chronic health condition or several since I was 11 years old. And so I have chronic invisible illness. And what I always tell people is that I really work hard to kind of pretend and push through and not let people see that part of my journey. And so for me, health is something that I really have to pay attention to. Not just, my weight management and my hormone management, but pain and symptom management as well. And so I go to all of the typical, appointments that I have, that we all do, our annual exams, our eyes, our ears, all of those kinds of things that we typically do. For women, the annual gynecological appointment, all of those. And then I have specialty areas that I have to follow up on as well. And so I always kind of think about that going into my new year. Okay, where am I needing to kind of work and manage my symptoms and manage my health better? If you don't have that as a part of your health history and your story, that's amazing because then, you're really starting at probably a healthy baseline and you can start to incorporate healthy habits if you aren't already or build upon the healthy habits that you have. And so your foundation, your 5 pillars of healthy aging are already on, a really solid foundation. But if you're like me and they aren't, you still can make a lot of improvements and changes as well. So hopefully we'll give you some good information to help with that today. So pausing and reflecting and resetting, I think is something that we should always be doing. I think we should do that probably on a weekly basis, not just a yearly basis, but certainly we should do it more than just at midlife. So I love Brene Brown. She is a social worker, she's a researcher, and she has a ton of books and free resources and podcasts and website and all of that kind of good information about just basically how to live well, how to live healthy, how to live well. And she talks about midlife in a really unique way, not as a crisis. So she calls it an unraveling. So she says, it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open up everything back up to heal the hurt. And so midlife is not a crisis, midlife is an unraveling. And I think that it can be in a really, really positive way, an unraveling, a peeling back the layers of the onion, so to speak, and figuring out, where are you? Where do you want to be and how do you get there? So it's kind of like dropping a pin on your GPS. Anytime you kind of set out to go on a trip, the GPS always asks you where you're starting from first. And I think that that's so important, especially for those of us who maybe do feel like we're in a midlife crisis. I read some research recently that said that a midlife crisis actually tends to last on average 7 years, and that around age 38 that seems to be the worst time of it, and around age 42 is when it gets better. I have some older friends and family members that confirm that has been true for them, and so I would say that so far that's been true for me. We'll see in a couple of years if age 42 things get better. But I think it's so important for us to realize that sometimes the midlife crisis that we experience is because our bodies are changing and our lives are changing. Usually, people who are in that 40 decade, 40 to 50, maybe even 55, you're usually, if you're a parent, you're usually parenting children who are aging, who are getting to those big milestones in their late teen or early adult years. For those of you who are a caregiver to parents, that's usually when parents typically start to having health declines and needing extra assistance. And so that's called the sandwich generation, where you're parenting and you're actually taking care of maybe parents or older family members or relatives, maybe even neighbors. And then it's also a time in your life in your 40s and 50s when you're starting to take on more work responsibilities. You know, you might be the manager, the director, the coordinator, the person that's supervising a lot of other folks. And so, certainly, age doesn't correlate to all of these things. It just tends to be a trend that we see. And so, that's been named or dubbed the sandwich generation for people who are in their 40s and even early 50s. And so, some common health concerns that you can see that kind of go along with those things and just typical aging is chronic pain, especially arthritis and back pain and tendonitis, and just generalized pain, meaning that you have maybe chronic or acute, so short term pain that's all over the body. Joint health and osteoporosis become a huge one, especially for women. Women tend to have signs of early onset of osteoporosis in their 40s. Doing things like a DEXA or bone scan can reveal that. If you have a history or a family member who has been diagnosed with osteoporosis, like my grandmother, then people in their 40s, especially females, because of the estrogen on board and progesterone, should start to really look at bone health. Milk is not the best source of calcium for your bone health. There are a lot of other good fruits and vegetables and things that can actually give you better sources of calcium, more bioavailable sources without the inflammatory response that many people have from milk. So there's a lot of good, research that's being done now of how you can actually curb some of that osteoporosis or delay the onset. Of course, stress, and that can be acute, meaning, I'm stressed right now, or chronic, meaning I have a long history of stress. And you can have both. You can have acute and chronic stressors. So, knowing what your stressors are really important. I bet we could probably pop in the chat, and feel free if you would like to pop in the chat some stressors that you might have. It's also important to know what those triggers are. So, a stressor might be getting everyone out the door and on time to work and school and wherever you have to go. A trigger might be all of the construction that's going on right now. Every day this week, I have been stopped at least three different times and three different points along my drive, my 20-minute drive from home to campus. And you never know how long that you're going to be held up with those. And so, the stressor might be being punctual, making sure you're on time. That's really important for nurses. We kind of have this clock in, clock out mindset. The trigger might be seeing that orange cone and the stop sign saying, oh, you're going to be delayed. So that's the trigger. So knowing if you have acute or chronic stressors, or both, knowing what those stressors are, and then knowing what the trigger is for that, so that you're not having this flooded experience when you realize, oh no, I might be late. And so building in buffer, so to make sure that you're getting to work or school on time, would be, setting your alarm clock earlier, leaving earlier to accommodate for traffic and delays. That would be building in buffer and margin for you. But what would that look like with your other stressors and triggers? We like to try to avoid stressors, alter them, um, or adapt to them. Those are usually the three A's that we typically use when it comes to stress. So think about that. If you have some ongoing stressors, how might you build in some buffer today for that? Depression and anxiety certainly can increase because of all of these work life demands. We talk about work life balance, and now we use more terminology around harmony or integration. So, work life integration, work life harmony. But certainly, when you're managing a lot of things at work, when you're managing your own changes in your own body and health, and then you may have family members, young kids, grandkids, or parents that you're helping, that can feel like a lot of pressure, particularly in a culture today where we want everything to kind of look polished and pristine and very Pinterest worthy, or Instagram worthy. it can be difficult to kind of reveal some of those areas where we're struggling, especially if we're struggling in all of those areas. Heart health, of course, blood pressure, cholesterol, triglycerides, all of those numbers can be tracked at Well-Bama screening. So it's always great to make an appointment. It's something that's free. And not only is it free, but you get an apple, you get to come see all of us at Wellness Work Life, you get an awesome t-shirt, and then you get your $50 for having completed the health screening. So it's really a no-brainer for you to just like write that in as a field trip and kind of schedule that and come see us. You also can note changes in your resting heart rate. That really will kind of speak to how much stress you're having and how you're managing that stress. Inflammation is something that I think we're going to really see more and more as the years go through the research that we are doing, that inflammation is really the root cause of many chronic health conditions that we're seeing. That's a huge part of the conversation right now in the medical world. Communicable diseases, so getting those vaccinations and boosters become a huge part of your kind of wellness checks once you reach the age of 40, things like flu and shingles vaccine. And as you get older and kind of reach more of the 50s and 60s, getting the pneumococcal vaccination or immunization to prevent against pneumonia. Of course, our blood sugar plays a huge part of our overall health. A lot of times when we think that we're anxious, it's really that we're having these dips and spikes in our blood sugar. And stress can certainly impact that as much as sugar, as much as sleep. So I say the three S's on that can really impact those numbers. And we don't talk about that a lot. Our body mass index, y'all, this is not the end all be all. There's a lot of problems with the body mass index or the BMI, but it is a good gauge to see where you are on that spectrum. Of course, skin and other cancers can become an issue, particularly after age 35. Skin checks can be really, really important. If you have a family history of melanoma or other skin cancers, that's really important for you to start getting those annual checks. Ask your healthcare provider, your internist, or a dermatologist. For me, I have a grandfather that died from complications of melanoma, and so I've had some concerning moles. And so I see a dermatologist every 6 months now for a check. Usually they'll start you out every year for an annual visit for a full body check. And then if you do have concerning moles or skin lesions, is what we call them, then you might move up to every 6 months or even every three. Changes in hearing and visual acuity can also start to happen. That tends to be either because of environmental factors. Maybe you're around a lot of noise in the environment and it's affecting your hearing. For eyesight, maybe it's that you're doing a lot of computer work. So always have your blue light blocker glasses on. It also can be related to hormones. So hormones can change, and hormones, particularly for men, that can change your hearing acuity. Men typically do not hear as well as women do when we're just looking at male versus female, which is how our medical research looks at it. Um, then for men, because of testosterone and other hormonal balances on board, that can be a time in the 40s and 50s where your hearing will change. It can for men or women, but men, it tends to be a little bit more noticeable. And so you might, have some changes in that would warrant you to either have, eyeglasses or hearing aids if you have changes in those. Hormonal changes, of course, is what we typically think about in our 40s. Our sexual health can be impacted, certainly, because that is also not just a body but a brain mechanism for your sexual health and sexuality, so changes can occur there. Lifestyle changes, which I've alluded to, and then mental health. Of course, if we have all of these common health concerns, if any of these are impacting us, we can have a mental health challenge, whether that's depression, anxiety, um, inability to manage our stress, or, poor resilience, or it could be more concerning mental health issues that would be a little bit more severe. So everything from, stress and anxiety to, actual mental health challenges that would need to be addressed by a professional. And so lots and lots of information and things to consider with this one. So screening and prevention is really the key to healthy living and kind of getting ahead of some of these challenges that we might face. So when we can prevent things, that's so much better than trying to improve them later. So what is it? An ounce of prevention is worth a pound of cure. I think I got that one right. It's a busy week, so I feel like I need a little extra caffeine today. But I think that's the way that the quote goes. And basically, it's saying that it's so much better to prevent anything than it is to try to find a cure for something. So at the Wellbama screenings, you can get a good check on your heart health because you're going to get your lipids, your cholesterol, your blood glucose. We can do that fasting or non fasting. And so if you just have water and black coffee and nothing to eat, then that's going to be a fasting blood work, and we'll adjust the numbers on our end. So, not a big deal for you to be concerned about. And if you have more than water or more than, just black coffee, you have cream and sugar, or you eat something, then that's going to be non fasting. And so, we'll adjust the numbers for that because that will impact the way that we read your cholesterol and your blood sugar. And then we'll let you know about health risk. You'll set health goals with your health coach, which is typically a nursing student, but sometimes a fifth year nutrition student who's working on their master's. Sometimes med students as well will participate as coaches. You'll get your blood pressure number, your triglycerides. We'll calculate your BMI because we'll do your height, weight, and your waist circumference. If you have, a history of disordered eating, eating disorders, body dysmorphia, or just, you're not in a place where you can do some of those BMI calculations, like your weight and your circumference, then you're welcome to tell your coach that, and you're welcome to self-report, or they can just make a note of that on your chart. So don't let that be a reason not to come. For years and years and years, I would not go to my Wellbama screenings because I was morbidly obese, type 2, meaning that my BMI was close to 35 and I was over 250 pounds. And I was terrified to go and see my nursing students that I taught because I was so embarrassed about getting on the scale. That was such a huge deal for me. Not even the number, but just the act of stepping on the scale was really hard, or having to twirl to get my waist circumference was something that was very anxiety producing for me. And so I think that's so important to normalize that a lot of us have those challenges. I've lost 85 pounds and I still have the same level of stepping on the scale and getting my waist circumference done. And so I just want to normalize that, because if you had asked me 85 pounds ago, would it bother me if I had lost the weight? I would be like, no, that's no problem. I'll be happy to do that. But some of those challenges that we have with body dysmorphia or challenges with our weight don't go away just because we lose the weight. And so, anyway, I felt very much like I should share that with you guys today. I hope that helps somebody. And then, of course, we'll talk to you about your activity levels. We would like to see that you're working out 5+ days a week. We like to see 150 minutes of moderate intensity exercise, meaning that you can exercise and you can still talk, but it's probably going to be a little bit more challenging. You might be a little out of breath, but you can still hold a conversation. That's going to be moderate intensity. Working out and lifting weights 3 to 4 times a week is kind of the gold standard for most people. But I always tell people, if you're not doing anything active right now, just getting up and doing squats at your desk, 10 squats an hour. Throughout your workday is said to, from research, to be as effective as doing a full body workout in kind of like that, ideal workout situation, because you're moving your body throughout the day. And your body would rather move throughout the day than having an intense 30-minute workout just for one portion of the day. So, consistency is really more important when it comes to our health and our wellness and our fitness goals than doing something perfectly for a short period of time. And that's something that wasn't always intuitive for me. So, annual physical exam recommendations. We do recommend that you see your healthcare provider for an annual physical exam. It really helps you to have a baseline of what your numbers are and what your health is, trending on and your goals. It also helps for you to have a good relationship with your healthcare provider because no one is really in the mood to develop a great relationship with their healthcare provider when you're sick. When you're going in with a sinus infection or the flu or something like that, that's not the time to get to know your healthcare provider. And so I actually have my routine annual physical exam with my healthcare provider tomorrow. So I'll go in for blood work in the morning and then I'll go back and see my medical doctor in the afternoon. And I do that every April. That's just on my, kind of perpetual calendar that I do it every year in April at the end of the spring. I kind of want to get away from like the the cookies that I eat over winter break as much as I can. So, with the routine physical exam, you're going to look for just routine medical issues, the things that we mentioned on that common health concerns slide. They're going to assess your risks for future medical issues. They're going to encourage healthy lifestyle that's tailored to you, and then you can update any immunizations or vaccinations. And it does help you with that relationship and that rapport, because then when you do come in with a serious health concern, you know your healthcare provider, they know you, and they're going to be able to give you really, really good recommendations based on that knowledge. So other things, you always want to have your physical exam with lab work. I'm always surprised when folks say that they had their physical exam, but they didn't have lab work. Lab work is really important because it makes the invisible visible, right? And it's not perfect. You can feel really bad and have a lot of health issues, and your lab work can look great. When I was 250 pounds, my lab work actually looked better than it did when I was in the process of losing weight. And there's a lot of reasons for that, and it makes total sense. But just because you're a smaller size doesn't mean you have perfect lab work. Just because you're a larger size doesn't mean that your lab work isn't great. My lab work at 250 pounds was amazing because the adipose tissue or fat tissue stores a lot of things that the body can't manage or deal with, for lack of a better term. And so any, toxins, any, viruses, anything that the body can't manage, can't process, can't deal with, will oftentimes get stored in our fat tissue. And so as we're starting to lose weight, those numbers start to change because if we're not exercising enough, if we're not having good bowel movements and voiding or urinating, if we're not sweating out the toxins and the different things that our body can't manage on its own, and we're not drinking enough water, then a lot of times that starts showing up in our blood work. And it's because we are doing really good things for our health. It's just that we haven't completed that cycle. So, dental exams and cleaning, of course, twice a year is best, every 6 months. And then our hearing screening, a lot of people don't have hearing screenings unless they have a problem after they get out of like grades K through 12. You get your state screenings during your K through 12 schooling experience, and then a lot of times people don't ever go for another hearing screen. But it is a really good idea to get one every 10 years until the age of 50. So, when you're 20, when you're 30, when you're 40, when you're 50, and then after the age of 50, because hearing can start to decline every 3 years after that, unless your healthcare provider, like your ENT, your audiologist, says that you need to have more frequent screenings. A comprehensive eye exam is really important with pupil dilation, meaning that they're putting those drops in your eyes that make you feel like you kind of got cotton in your eyes. So that lets them be able to look at the vessels, the blood vessels, and the structures in your eye, to make sure that they're really healthy. So that's an important thing to do. If you see an optometrist just to get your eye prescription, your glasses filled, you want to think about getting an ophthalmologist to actually be able to do the comprehensive exam so they can look at the actual health of the eye. Usually, we recommend that annually. Some people will go more often if they have high blood pressure, glaucoma, other factors. Um, you might have floaters in your eye or a lens issue. There's a million reasons why you might go more frequently. There's also reasons why you might not go as frequently. For me, because my eyesight has actually improved over the years, which is not typical. And it, I think, was due for me to inflammation. I have been told that I can go every 2 years now, and so it's just something that's very individual. But that's why it's so important to have a healthcare provider that you know and trust. Blood pressure screenings, cholesterol, diabetes, those are all things that can we can start doing at health screenings for Wellbama. And then, of course, if we see something that needs further follow up, then you can reach out to your healthcare provider. And these are things that should be done annually anyway with your healthcare provider, whether that's a nurse practitioner or a medical doctor, or even perhaps a physician's assistant or associate, rather. That's their new name. So baseline EKG, that's something that some practices will actually do. I have not had a baseline EKG for my annual workout up, but with my practice with my doctor, I believe it's if you have a something that's concerning, or I believe after age 40 is when my doctor starts doing a baseline EKG and chest X-ray. So that's not part of my annual routine right now, but that will be coming down the line in my 40s is when they start that at my doctor's practice. And then checking thyroid health. So looking at lab work is really important, but also knowing symptoms, because thyroid health, that's like the engine of our body. And so that can certainly start to become sluggish, is what we usually say. Also, your adrenals play a role in this. So, lab work is important, but your body will compensate for a good while on most things. So, your blood work might look great, but you might still not feel wonderful. And so, just knowing that tracking your symptoms, being very specific about those, having them palpate your thyroid, meaning that they use their fingers and they will actually palpate on both sides of the thyroid gland. It's like a butterfly shaped gland on either end of your trachea right there. Um, all of those are good things to do, because sometimes you're diagnosed by symptoms more than you are blood work, depending on what is actually going on with your health. So just because your blood work is great doesn't mean that you aren't having some challenges. So trust your body in that, kind of your inner knowing. Let that be your guide. Immunizations that you can do annually, of course, the flu, tetanus booster as recommended, the pneumococcal as recommended. Usually you're in closer to your 60s and 70s before you start getting that vaccination. Unless you have a history or you're immune compromised, then you might have a reason to have that. Hepatitis as recommended, especially for healthcare workers and other folks who would be susceptible. Colorectal screenings are really important. This is starting to become more an age 45 test that you will do. And so even age 40 for some people who are high risk. Textbook has always been age 50, but we're seeing that be reduced not only for the colorectal screenings, but also for breast exams. So we'll talk about that. And then a colonoscopy usually is recommended every 10 years once you start to kind of get to that mid-age life. And then you can do fecal occult blood test, or the FIT test, where it's looking at your BM or your stool, and that can check for blood, and that's really an important indicator of colon health. So those are all good ones that you can talk to your healthcare provider about. Some other things, mammography or thermography, looking at your breast health is so important. And as important as doing these screenings is doing your regular self breast exam and self testicular exam. So, these tests and things that you can do, there's blood work to check for the prostate, there's imaging to check for cysts and for tumors and things in the breast. But doing your self exams, so having that on the calendar every month. For women who are still having menstrual cycles, they're still bleeding, you want to make sure you're doing this after your period cycle, usually a week after, when you're not going to be as tender and sore, and having that on your calendar. For women who don't have a period, I always tell them to pick their birth date. or some other date that's meaningful for them to do these kinds of tests. So for me, I was born on February 12th. So the 12th of every month, because I am post hysterectomy, then I can just say every month on the 12th, I can do my self breast exam. I actually was doing a self breast exam in my early 30s and felt a cyst and what felt like an enlarged nodule, or lymph node. And so I was followed for 2 years and it was never picked up. The only time I typically will have a provider do a clinical breast exam is when I have my gynecological visit in the summer. My medical provider typically doesn't do that. Now that I say that, he probably will tomorrow, but typically he doesn't. And so you might have one or two opportunities to get an actual physical clinical exam as a female if you're not being followed. And so I just happened to be doing my self breast exam, and I felt that, and they do the positioning based on clocks, as if there's a clock sitting on your breast. And so at 3 o'clock on the left breast, I found that, and then I was able to have a lot of follow up and was able to give me some peace of mind. It turned out to just be an inflammatory cyst, and it took a couple of years for it actually to go down. But knowing that I had been proactive felt really good. And it turns out my mom had had a very similar experience in her early 30s. And so knowing your family history can be very helpful to you and to your provider in that way. So there's some recommendations listed here. Earlier exams in terms of using a mammogram is starting to be seen in the early 40s for people, even without high risk, because lately, especially since, and I'm not saying this is related to COVID, so don't hear me say that, but new research out since COVID has shown a lot of women in the last 5 years in their late 30s or early 40s having an earlier, younger diagnosis of breast cancer. Again, there's no correlation made there. It's just that's the timeline. And research has really changed since COVID. We're being very, very specific in looking out contributing factors that may be causing, whatever we're studying. And so that's really important to know. So most breast cancer is actually detected by the woman herself doing these self breast exams. Without getting into too much detail here, what you want to do is you want to take the finger pads of the first 2 or 3 fingers, and you want to go in a circular motion, starting at the nipple line and working your way out. And you want to make sure that when you're moving your hands that you're not picking your fingers up, because if you pick your fingers up, you may miss a spot, okay? Because these can be really tiny. Mine was really tiny. And so you want to make sure that when you're moving your fingers that you're not lifting the fingers off of the skin. And you want to just, lightly depress it. It shouldn't be painful, but you should depress and push hard enough that you actually can displace the breast tissue. You also can do that along with the lawnmower method. So going up and down like you would do a lawnmower, and going all the way into that tissue underneath your arm and down your breast, because a lot of women who are younger who have breast cancer or issues with their breast, it's in that kind of the outlying area. It's under the arm. It's like not on the breast itself. It's actually out in that other kind of outer tissue, which is where mine was. That's very, very common. For men doing the testicular exam, they can pick a date. Again, you're going to do the same type of movement where you're going throughout all of that tissue, and you're just really palpating the whole area, making sure that there's been no change in how much the testicles, hang down or kind of withdraw sometimes when there's an issue, making sure there's no lumps, mumps, bruising, tenderness, anything like that. You're looking at the same thing for the breast. So for men, the average age of 50 for the risk factor for prostate cancer. So you would start to have perhaps an actual exam. Usually with a urologist is going to do the prostate exam. And age 50 is typically when you see people start to have those. And then for those people who have risk factors, they'll go more often. Age 45 for men who are at high risk, and then age 40 for men even at a higher risk. And then we also recommend people to assess their nicotine and tobacco use, and of course, vaping. Those are things that can really impact your overall health. Once you've gone 10 to 15 years without using the nicotine, the vape, the tobacco products, your body resets itself to that of a non-smoker, a non-vapor, a non-tobacco user. So it's really important for people to know that. It's also important to know that just because you've gone your whole life and smoked or used tobacco or, vaped or something like that, um, doesn't mean that like that and you haven't had any issues doesn't mean that someone else in your family hasn't. For example, my husband smoked in his early 20s and he has a lot of residual lung issues today from that, especially post COVID. His grandfather, however, smoked his entire life, and his MD said, "You have the lungs of a baby." Even though he had smoked his entire life, they were trying to get his family, they were all trying to get him to quit smoking. And the MD said, because grandfather was in his 80s, they said, it probably at this point doesn't really matter, and his lungs look amazing. Whereas my husband smoked for 10 years in his 20s, stopped in his early 30s. He's in his mid 50s now, and he doesn't have the lungs of a baby, unfortunately. And so it's just important to know that our dynamic, our lifestyle, our stress, our DNA, our genetic factors all play a role. So it's always a good idea to stop trying to do these things that may impact our health. It's always a good idea, no matter how old you are. If you feel like it's impacting your health, go ahead and make a baby step. For me, when I was drinking 6 Mountain Dews a day, I stopped drinking 6 Mountain Dews and drank five. I didn't go cold turkey. And so I eventually worked back to, I have not had a Mountain Dew in 12 years, 11 years, 12 years. It's been so long. I know it's been over a decade, but I used to not be able to go a day without drinking a Mountain Dew. I would have one morning, afternoon, evening at bedtime, and then one with each meal. So I had a minimum of 6, 12 to 20 ounce Mountain Dews a day. And now I haven't had them in over a decade. So I would not have believed that 15 years ago, but that's my story today. And so I'm better for that. So always want to encourage you to just do the next best thing. Sometimes it can feel really overwhelming, but it makes a huge difference in the lifespan of your health span, right? And so make fiber your friend. That's really good for gut health, particularly for your colon. Fiber is going to help make your bowel movements easier on you. It's going to help lower your cholesterol that we consider your quote unquote bad cholesterol. And it really can be helpful just to your overall health. Building muscle and working toward good bone health is also important. So, stretching, exercising, moving your body, building muscle. The more muscle you can build, the easier it is for you to lose weight a lot of times and maintain your weight. Also, the more muscle you have, the better it is just for your overall health in terms of looking at your longevity, because it means that it's protecting your bones and it's protecting your overall health and wellness. It keeps your metabolism in check and does a lot of really good things. Your overall health recommendations are screenings. So you can use this as a checklist. Again, this is not all encompassing, but it's a great place to start. You also have your cancer screening guide, so looking at breast cancer, cervical cancer, so having your pap smears. Again, this used to be something you did yearly starting in your 20s for your pap smears. Now, most people who've had at least 1 to 2 negative pap smears can go 3 years. Your colorectal screenings, your lung cancer screening, so starting with that chest x-ray we talked about. And then, of course, your prostate, adding that in for those of us who would be at risk for that. So, some hormonal changes that you can have with menopause. So, no menstrual cycle for a year is considered going into your kind of your final stage of menopause. Of course, your premenopausal before you start to have symptoms. Peri means around, so it's around the time of menopause starting, which is typically in your late 40s, early 50s. so 45 to 55, with the average age of being 51 for most women. That is much younger than in worldwide. Usually it's more like your 60s around the world. And of course, you can have hot flashes, dryness, vaginal dryness, skin dryness, mood swings, decreased libido, decreased concentration, and brain fog. A lot of times it's because of poor sleep, but it can be because of other factors. Insomnia, hair loss is a big one that people don't think about. Weight gain, so think like 10 to 15 pounds, but nothing else has changed. And then metabolic syndrome, which can increase your risk for cardiovascular disease, stroke, blood clots, and type 2 diabetes. All of those things can start to take hold at midlife. And then for men, testosterone is the big one. So after age 30, you start to have a drop in a 1 to 3% um, testosterone levels. And it says around age 40 now. I last week saw that it's actually starting at age 30 for men now. So I need to update that and cite that source because that's surprising. So it looks at men's testicular health and testosterone levels. And some research is indicating that men in their 30s, 20s, and 30s have lower testosterone than their grandfathers would have in the 70s and 80s, and kind of going throughout life. And so low T is something you'll hear on commercials. Testosterone is not just for sexual health, it's for all, functioning for men, really. It can result in decreased libido, but hair loss, fatigue, mood changes, lack of motivation, and an onset of depression is a big one. Anemia, if you have a man in their midlife and they're anemic, unless they're having an acute blood loss, always think testosterone being low. And lots of other changes, holding on to body fat around the midsection when nothing else has changed. They can have decreased bone mass as well. And so it can also impact their blood sugars and their stress levels. So it's really important for us to note that because testosterone is not just about sexual health, it really is about holistic health for men. And then weight loss over the age of 40 can be challenging because our cellular growth can decrease. It's not a given, but it does eventually start to decline. Lifestyle changes, weight loss resistance, and then our metabolism just does not compensate quite like it used to. So our digestion can play a factor as well, and our gut health, meaning that we've gone through more things. Our gut health will take a hit sometimes when we've had too many antibiotics, too many viruses, bacteria, things like that. Over time, that can impact our leaky gut and our digestive ability, and that's going to impact our metabolism as well. So this is a guide. This is the strict BMI. And so again, this is just a benchmark for you to reference in terms of looking at what you weigh and what your calories might be if you are pretty low activity, medium activity, and high activity. And then resting calories is that you're really sedentary, that you're not doing much more than just kind of getting dressed and getting up for the day and maybe sitting a lot. So this is a good guide. It's a place to start. I have found that ChatGPT, with some recommendations from a registered dietitian nutritionist for me, has been a great way for me to calculate based on some numbers that my RDN has given me through the Nourish app that's paid for by our Blue Cross Blue Shield policy. I can really start to tweak what my macros and what my vitamins and nutrients and minerals and things look like, those goals, with ChatGPT making menu plans and grocery lists for me. So I highly recommend that if you feel comfortable knowing what to look for in those kinds of plans. That can be a huge help with making a plan that works for you. And then these are healthy strategies. This is meant to be a toolkit. So I'm going to fly through these because I want you just to reference this as needed. So, some healthy habits by 40. These are healthy habits for literally anyone. Like, these are things that I have my teenagers thinking about. Of course, not number 8, that's not age appropriate, but the rest of these are very, very much appropriate for anybody of any age. So, drinking more fluid, making sure that you're maintaining the things that cause major stressors in our life. Our finances, our health, and our relationships, including our sexual health, are all things that really play huge factors into our health and wellness. And then, of course, adding in good things like positive attitudes, meditation. So, this is the blog where I pulled these 10 healthy habits from. And you're welcome to click on that link. It's got some really good information there for you. Wellness basics, we have a class on wellness basics. It's one of my favorite to teach, but it talks about how to sleep well, how to stay hydrated, how to eat healthy, so a nourishing diet, moving your body every day, which is not just, structured hit workouts. It's literally doing, squats. It's taking laps around your building on your breaks. And then, of course, mindfulness, meditation, taking good brain breaks. So start with 3 to 5 minutes once a day. I really think a good recommendation is 15 minutes 3 times a day. So morning, noon, like afternoon, and then evening to have a 15-minute break 3 times a day. That's only 45 minutes, and I think it can be really impactful, not only for your body, but for your brain to have that built-in rest. I tell people to do that a lot better than I actually do it myself, but it's one that I have committed to working on this month. It's something that I really need in my life, and so it takes about 21 days to start to form a habit, but by the end of 90 days or 3 months, you really have started to make that a lifestyle. Excuse me. And the more that you can make that a lifestyle, the more it just becomes habituated into your routine. And then you just do it because it's time to brush your teeth, it's time to do your mindfulness break. It just becomes a part of who you are. And that's really, really helpful for sustainability. Overcoming changes with your weight management. So, anytime you gain more than 5 pounds, I think it's worth kind of assessing what might be going on. Typically, people's weights are going to fluctuate 5 to 10 pounds or so. Back in the day when I was 250 pounds and having a lot of inflammation, I could gain 6 pounds over a weekend really, really easily. And, 2 pounds is considered alarming for people who have heart conditions. So 6 pounds was a lot for me to gain over the course of, I could weigh on Friday, and when I weighed on Monday, I would be 6 pounds heavier from over the weekend. And most of it was water, but some of it wasn't. And so if you are starting to gain more than, or, kind of gain and lose more than 5 to 10 without trying, that's something that you really want to be aware of and talk to your healthcare provider about, especially if you can notice trends in that. So other things that you can do is really eating for calorie dense, calorie rich food with a lot of good nutrient dense food. People will say all the time 100 calories is 100 calories, but 100 calories of M&Ms and 100 calories of kale are two different things in terms of the nutrients and energy that you're getting. So in terms of weight loss, calories in, calories out, move your body is kind of the standard. But in terms of nutrition, of fueling your body, the 100 calories you're eating really does matter what sources you're getting that from. So avoid those empty calories like drinking your calories, which is so fun to do. Make sure that you're really well hydrated. Your body is going to hang on to fat and anything else that it needs to be doing if it's not hydrated. Most of our body is water, some form of hydration. And so we need that to be able to function at a cellular level. And then make sure that you're getting in your good healthy fats, your good carbs, and your protein. Most people, especially women, undereat your protein, and so I would say a third or a half of the protein that we need every day is probably what most women are consuming, unless you're being really intentional with that. And so making sure that those things are accounted for in your nutrition plan is important. Of course, fitness is so important. Stretching, moving your body. If you don't move it, you lose it. And so you want to maintain as much flexibility as you can, as much muscle mass as you can, because that's going to bode well for you in terms of being able to be active and healthy in your 70s and 80s. And then some things that you can do to start walking is low impact. We're about to be in the season of swimming. Swimming is also another great one. Not as accessible as walking for some people. But walking and swimming are two great things to do for your cardio health and just overall in general. And it's low impact and it can be fun. So make it fun. Some other things to remember is stretching your muscles before you start to do anything, even an extended walk is important. Having a routine and putting it on your schedule is also very important. Pacing yourself. So, we do the Crimson Couch to 5K, but we do that in a sustained way. We're pacing you. You don't run 5 miles after you've just gotten off the couch, right? You have a plan. And so pacing yourself is really important. Some other tips for staying fit. Again, you can print this slide and use it like a checklist. I think it's really, really important to have some goals. So go ahead and give yourself credit. I joke and tell people some days the only thing I have going for me is that I'm not using tobacco products because everything else I'm 100% human and struggle with it just like you guys do. So yeah, give yourself credit for where you're getting it, quote unquote right, and then just do the best you can. Pick the thing that you want to work on. People are saying that sitting is this new smoking, and I really do believe that sitting is not good for your health. Some other habits that you might consider, and just remember that the best is yet to come, and truly is. We're just getting to the good part at 40 and beyond. And so for those of you who don't feel that way and feel like, I really don't want to think about that, is I saw this on Instagram. It said, imagine that you're 80 or 90 years old and you could go back and relive your life again starting at age 40. So when you feel like you're sad that you're not 20 anymore, right? We have those moments. Go back and think about what you would tell yourself if you were 90 years old, going back and reliving, your 40s, your 50s, your 60s, etc. And I think that's such a good mindset shift. And then just to close out, I mentioned the caregiving aspect of being in the sandwich generation. And so I put this here. It reads like a poem. It's called Put the Pickles on the Side. So maybe that'll speak to you. If not, save it for later because I'm entering the sandwich generation with my kids and parents. And it is a unique time in life, let me tell you. It is definitely something that requires a little more intentionality, a little bit more support. Pain management can be huge. So there's things like rest, ice, compression, and elevation and over-the-counter pain meds. But doing things like stretching, yoga, Pilates, knowing your limits can really help in preventing some pain. Gut and inflammation, it's all about diet and managing your stress. Eye health, making sure that you're wearing eyeglasses and make sure that you're wearing sunglasses out in the sun, protecting your eyes and getting that exam so important. Wear safety goggles. That's a rule in my house. My husband would not wear them if I didn't require it. But when you're doing projects, make sure you're wearing safety glasses. If you have kids that love to play games that like shoot darts or something, make your kids wear them. So when my kids play with their Nerf guns, we have them wear safety goggles because that's one of the number one eye injuries in children, is Nerf guns, the little darts to the eyeball. Sun exposure is always important, checking your moles, making sure that you're staying out of the sun as much as possible between 10 and 2 because that's when you're getting the most rays, and making sure that you're checking your skin for these things. So is your mole asymmetrical? Is the border uneven? Has the color varied or changed? Is the diameter bigger than your pencil eraser? Or has it changed or evolved? Or is it elevated? Or F, we say it in nursing, F, it's just funny looking and we're concerned about it. And then know your risk factors for shingles. Getting that booster can be really helpful. Even if you've had the vaccine, even if you've had chicken pox, you are at risk for shingles. Happens in midlife when you're stressed out. So pick the most stressful time in your life. That's usually when shingles will pop up, and it's around usually the front and back of the rib cage. And then, of course, take care of your mental health. We're all just walking each other through life, right? And having a good support system is so important. Sometimes we need extra assistance. We have a lot of great programs here in our community, on campus, and through our, behavioral health resources. So you get 5 free visits with a qualifying concern or issue. And so I think that's really important. And after that, you just pay your copay. And then habit change. Slow progress is still progress. So just one step at a time. Here's some other recommended webinars, and we would love for you to follow us. I know that we are coming up on 1 o'clock, but I'm happy to take any questions or comments. That was a lot of information, lots of storytelling, but I hope that some of that resonated with you guys.
There are two questions. One is this is from Carrie. What are some of those sources of calcium you mentioned that are better than milk?
Yeah, there are a lot of good ones in terms of like leafy greens. Let me give you, I'm gonna pull up my list.